Hello everyone and welcome to today's Facebook Live with GBMC Healthcare. Today we're talking about some common concerns when it relates to summer. So let's welcome our guest, the chairman of family medicine at GBMC Health Partners, Dr. Kevin Ferentz. And we want to hear from anyone who's watching, so please don't hesitate to ask us your questions, okay? So welcome, Dr. Ferentz. How are you?
I'm good. Thanks for having me.
Thank you for being here. So the summer is winding down, right? But the temperatures tell us otherwise.
Oh yeah, it's still plenty hot. And it's plenty easy to get sick with sunburn or with heat exhaustion, so we got a lot to talk about.
Yes, we do. So sunscreen first, let's talk about that. What kind should I wear? Does the number even make a difference?
So the number does make a difference,
okay,
probably until you get over 30. Once you're over 30, you're probably okay, and probably under 15 is not enough. So most people should be using either a 15 or a 30. The truth is, the best sunscreen is the sunscreen that you're going to put on.
Right, okay.
And so whatever brand you like, whether it's a lotion or a cream or a spray, and we'll talk about sprays a little bit, but it's important that you put on sunscreen, especially if you're going to go out in the dangerous part of the day, which is 11 in the morning till 3 in the afternoon.
Okay, so when I'm putting it on, is there a certain way? We talked about the spray, right? So explain to me what we need to do for spray.
Yeah, so the issue with the spray is people think they can get away with it by just, spraying a little bit on. But actually, if you're going to use the spray, and it's totally fine to do that, you have to rub it in.
Okay.
Okay, after the liquid is on your skin from the spray, you then have to rub the liquid in. And you always have to reapply sunscreen. There's no such thing as waterproof sunscreen.
Okay.
When you sweat, when you go into the pool, you have to reapply sunscreen, usually every couple of hours.
Okay, so what happens if I forget all of that and then now I have a sunburn?
So it depends on how bad the sunburn is. The easiest sunburn to deal with is just what's called a first-degree burn, where your skin gets a little bit red and it's tender and you're just not happy about it, often on people's backs, sometimes on their neck and on their face. So the easiest thing to do for that is just to take a simple pain medication like Tylenol or Aleve or Advil. Put cool compresses. If you put something in the freezer, like a washcloth in the freezer, and put it on the burn, that will feel a whole lot better. And then you can also use 1% Hydrocortisone Cream, and that will also help the burn resolve a little bit faster.
Oh, so hydrocortisone on a burn, okay.
It does, yeah.
Didn't know that. Okay, I want to rewind and ask you. So I have a little boy, everybody knows he's 2.5. So we get the sunscreen on, but my husband swears that he does not need it. Who needs sunscreen?
Yeah, your husband is unfortunately wrong. Every baby over the age of 6 months needs to have sunscreen on. The only reason why we say not before 6 months is because we just don't know if it's safe in kids under 6 months. So every kid who goes outside who's over 6 months needs to have sunscreen on.
So my husband's brown. He thinks he doesn't need it.
Yeah, well, he needs it also. So African American people, people with darker skin also can get skin cancer. Less than Caucasians, but still happens. And, everybody knows about Bob Marley, the famous Jamaican musician, artist, and he died of a melanoma. He had a skin cancer under his toenail, and that's what killed him.
Okay, so melanoma is really common, right?
Melanoma is the least common of the skin cancers, but still pretty common. There are tens of thousands of cases of melanoma in the United States every year.
And very dangerous.
Unfortunately, if you don't catch it, if you catch it early, 99% cure rate. I had a melanoma when I was graduating medical school in 1983, a long time ago.
Wow.
And luckily, we caught it very early. I didn't have to have any chemotherapy or anything. I had some additional surgery done after it was taken off, and I was obviously cured because it's 36 years later. But because of that, I feel very strongly about people taking care of their skin and not exposing themselves to the sun too much.
So what should people look for?
So it's usually a mole that is usually changing, It often is not a uniform color. It's a mole that may have black in it and brown in it and red in it, and it's usually bigger than the size of a pencil eraser. Okay, those are the classic things. And if it's changing, if it's evolving, you need to see your doctor for them to take a look at it.
So do they just appear out of nowhere?
They do, yeah, it's just happens. And it can take, melanomas go through two kinds of growth. One is it grows bigger, and then eventually it grows deeper.
Okay.
As long as you get it when it's still thin and not diving deep, you're going to be cured with simple surgery.
Okay, and it can be anywhere on the body though?
Usually in sun-exposed areas, but yep, you can get it anywhere.
Okay, we have a question from somebody on social media. Mindy. Mindy says, why does it feel like a hot shower helps a sunburn?
Well, Mindy, I actually can't explain that. Usually it's cold that feels better when you take a hot shower. But if a hot shower works for you, go for it. That's totally okay.
All right. And so you talked about we can even get sunburn on our scalp, right? There's ways that you can protect your head, your forehead.
We can. Those of us who have less hair on the tops of our heads can easily get sunburned on the top of our head. And I had many sunburns on my head as I was growing up, and I actually had another skin cancer called a basal cell on the top of my head. So you have to wear a hat. It's really important. And they actually make hats that have sun protection in them. So you can get an SPF 50 hat, and then you don't have to worry about getting skin cancer on your head.
Got it. Okay, Mindy has a follow-up question. She said, is that safe?
It's definitely safe. You can take a hot shower. Yep. Now, we didn't get to talk about more serious sunburns,
okay.
So let's spend a minute on that.
Yep.
So the first degree burn that's red and hurts is going to be fine. In 2 or 3 days, it's going to get better. It's probably going to peel, and it increases your risk for skin cancer. Okay, all you need is 5 bad sunburns in your entire life to double your risk of melanoma.
Wow.
Okay, so it doesn't take a whole lot of times to get burned. A second degree burn, sunburn, is where there are blisters. And that one sometimes needs medical attention. If the blisters get really big and gnarly and you can't move because of them, it's best to see your family physician and have them open the blisters so some fluid can drain out.
Okay.
We don't recommend people at home draining their blisters because the blister itself is sterile.
Wow.
And once you poke a hole in it, you're at increased risk for infection, and then we'd have to keep an eye on it.
Okay, wow, that's so much information. Okay, so the sun can still be dangerous even if you're not burned, right? Can we talk about heat stroke, heat exhaustion?
Absolutely. So people who are at risk for this are people who are outdoors during the day and usually wearing significant amounts of clothing. They're not at the beach.
Right.
So firefighters, construction workers, policemen, athletes. I mean, athletes are at risk for this as well.
Right.
So the lowest is heat exhaustion. So it's still pretty significant, but that's usually what we consider as the first problem with heat.
Okay.
And it's where your body just can't get rid of the heat that's building up in our body. So we're supposed to get rid of heat by sweating. But if it's really hot and humid outside, the sweat doesn't evaporate, and you actually can't get rid of the heat. So if you were to take the temperature of a person with heat exhaustion, it's usually between 101 and 104. And of course, our normal temperature is 98.6.
Right.
So for people who are having heat exhaustion, they need to get out of the heat. You need to get them to a cool place. You need to give them cool things to drink. And one of the things I usually recommend to have around is if there's ice, put ice packs on the person's neck, in their armpits, and in their groin, because that's where the big blood vessels in our body are closest to the surface. And it'll be able to cool down your body faster.
So how do you know if somebody is going into having heat exhaustion?
So they'll feel like they're gonna faint.
Okay.
That's what usually happens first. People just feel really unsteady and they feel like they're going to pass out. They may have palpitations, their heart may be beating really, really fast, and they got to lie down. They feel like they have to lie down. And that's actually what you want them to do. You want them to lie down. And when they lie down, you want to elevate their legs, because then more blood flow will go from their legs back into our core. And so our heart will be able to pump more blood and they'll feel better because the blood's going to their brain and they don't feel like they're going to pass out.
Okay, so what happens if they do pass out?
Okay, so then it's really more likely to be heat stroke. Now, heat stroke happens when people's core temperature is 105 or higher, and our brains don't like that high a temperature. They just don't do well with it. The proteins start to not work right, and unfortunately, you're at risk for dying and other organs failing. And so people can have a seizure, they can go into a coma. I mean, it's a really serious problem. And we had, unfortunately, the death of that College Park athlete.
Right.
So if somebody has loss of consciousness out in the heat, that person's got to get to the emergency room right away.
Okay.
But when you call 911, don't forget to do all those other things that we talked about. If you have ice packs, put the person in ice if you can. If there's a bathtub, pack it with ice and put the person in. That's what saves their lives.
Wow.
Then when they hit the ER, they're going to ice them down. They may give them cool IV fluids, and that cools their body. And then they're going to have to watch them for a while to make sure that their brain hasn't been injured.
Okay, it's an important topic. I want to get back to it. We have a question, though, on social media. So Dennis says, are there certain sunscreens that should be avoided?
No, there's no particular sunscreen that you should avoid. I would say the only ones that people tend to avoid is not the sunscreen, but the sun blocker. It's zinc oxide. It's this thick white stuff that lifeguards used to put on their nose on the beach. I would say those should be avoided only because they look kind of silly, but they still work.
Okay, so nothing else. All right, well, thank you, Dennis, for your question. So what are some ways that we can avoid going into heat exhaustion?
So wearing as little clothing as is possible, depending on your job that you're in, making sure that you get into the any cool area as fast as you can.
Okay.
You need to make sure that you're staying hydrated with cold, usually just cold water is all that you really need. And if it's really hot outside and you don't have to be outside, you just shouldn't be outside. The other people who are unfortunately at increased risk for heat exhaustion and heat stroke are older people. And then there's a whole long list of medications that people could be taking, blood pressure medication, antidepressant medication, that unfortunately increases people's risk for heat exhaustion and heat stroke.
Oh, wow. Okay, and so you talked about dehydration. How much water is enough water?
Enough so that you don't feel thirsty.
Okay.
It's not really a specific number. Okay. People are supposed to drink when they're thirsty. Now, when you have heat exhaustion, you may get to the point where you're actually not even thirsty anymore. So I would say, most people should be drinking in a really hot day. I mean, like we had this week, where it's 98 degrees or 99 degrees. If you're outside, you should have cold water with you all the time, and you should be constantly taking little sips of cold water.
Okay, I have another question. This one is going to be from Tyler. He says, if I'm swimming, am I still at risk for heat exhaustion or dehydration?
So that's a great question. I would say that as long as the temperature of the pool water is pretty cool, I mean, at this time of year, you can actually go swimming and it may feel like a bathtub.
Yeah.
And I would say that those pools, you could still be at risk. Also depends on how vigorous is your swimming. I mean, if you're a Michael Phelps and you're swimming in a hot bathtub, you could potentially still get heat exhaustion.
Okay, all right, great question, Tyler. All right, so now let's talk about ticks.
Okay.
And the other outside critters that we have to watch out for. How dangerous is a tick bite?
So, we're living in a part of the country where we do have a lot of deer ticks, and that's the tick that transmits the bacteria that causes Lyme disease. So everybody is always freaking out about ticks. Now, most of the ticks that you actually get are usually not deer ticks. They're dog ticks are the most common one. Oh. And so there are, as we head into the fall especially, when people are out walking in the woods because the foliage is beautiful, that's when people wind up getting deer ticks. Or if you live in a community like where I live, there are deer in your backyard.
Yes.
So actually you can get deer tick bites from just even being in the backyard, or it can be transmitted to your pet. So when we talk about preventing deer tick bites or tick bites in general, you also have to make sure that you've been to the vet and to make sure your pet is taking a tick repellent as well.
So what are some of the signs to look for if you think that you were bitten by a tick?
Well, the tick would usually still be there.
Okay.
I mean, most of the time when a tick bites you, it needs to fill up with blood. And when it starts, it's a tiny little thing. And after 36 to 48, even 72 hours, it could be on you for 3 days,
Wow.
it will be this big red thing filled with blood. And then when it's full, it'll disengage.
Right.
So one of the great reassurances that you can give people is that Lyme disease is not transmitted unless the tick has been on you for at least 36 hours. So if you wake up one morning and you're going out camping or you're doing a walk in the woods and you don't have any ticks on you, and you come home later that day and, oh, here's a tick, you can't get Lyme disease from that. It doesn't happen. It's got to be there for a long time, and they have to exchange your blood with the tick and all that other stuff. But take the tick off. I mean, you definitely want to take the tick off. And the way to do that is to take a tweezers and grab the tick and then slowly pull up on it, like with firm pressure. I can see this is really moving you. And you slowly pick it up, and then the tick will usually pop out, okay? And if the tick has been on for 36 hours or more, if there's a chance, then you need to come to the doctor, because we will usually give you 1 dose of antibiotic, just 1 dose, and that will prevent you from getting Lyme disease.
Okay, perfect. I have another question from social media. This one is from James. He says, can you get a sunburn if you already have a good tan?
Yes, you can. You can have very tan skin, but if you still go out 11 to 3 and you're not putting sunscreen on, you absolutely can burn on top of a tan.
Okay, so I guess going back to some of the sunburn, what are some of the ways that if you have to be outside or maybe you're on vacation, are there like certain intervals or anything else that you should do, umbrellas, hats, any of that stuff? So
all of that is really very, very wonderful to do. Wearing clothing that has sun protection in it. I mean, besides the hat, they now make shirts that have sun protection. Try to cover as much of your body as you can, as long as you're not going to develop heat exhaustion. Stay out of the sun between 11 and 3. If you're at the beach, if you can afford it, get one of those nice umbrellas and sit under the umbrella. And if you do go into the water, make sure that you reapply your sunscreen after you come back out of the water. Okay,
I have another question from Facebook. This one is coming from Shelly. She says, when playing sports, does it help to hydrate the day before the game?
Well, I mean, it doesn't hurt, but it won't make up for not hydrating on the day that you're actually playing. I mean, our bodies are funny. You know, if you hydrate a lot the day before, that night you're going to be going to the bathroom a lot, because our kidneys get rid of the liquid that it needs. So, I mean, once it has all that it needs, it gets rid of the rest. So it's good to be hydrated before you start exercising, but it's more important that you make sure you stay hydrated while you're exercising.
What about sports drinks? Would they help?
So they can help. I mean, but I'm not telling people that they have to take sports drinks. Sports drinks have some electrolytes in them. Certainly, if you get to the point where you have heat stroke, the person is going to have fluids with electrolytes, because you can get all different kinds of electrolyte abnormalities when you have heat stroke. Most of the time with heat exhaustion, water's okay, but if people have Powerade or Gatorade and that's what they want to give the person cold, that's fine.
Okay, perfect. I have another question from social. This one is coming from Dennis. Oh, can the heat cause headaches? I'm going to say yes.
Yeah, you were absolutely right. You can answer the question for Dennis.
Yes, Dennis. I had one last week, like all week. No,
yeah, so the heat can cause tension headaches. It can actually precipitate migraines also for people who get migraine headaches. Any extreme of the temperature, very cold, very hot, can make a person get a migraine.
So why? Why?
Probably the tension headache part is because you're getting a little dry. Right? And actually that would apply to the migraine also. If you're getting a little dehydrated, that can precipitate a migraine.
Yeah, okay, I was going to ask you if the dehydration had anything to do with it. Okay, I have another question from social. This one is from Tanya. Oh, she's going back to the ticks. Once the tick is, it's Tova. Once the tick is removed, does it need to be saved for review? Good question, Tova.
So unless you brought the tick to a bug specialist, I don't know that there are many doctors who'd be able to look at a tick and say, oh yeah, that's a dog tick versus a deer tick versus any of the other kinds of ticks. But if you want to keep it for your scrapbook, I mean, I guess you could.
Okay, you know sometimes they'll show like the little splotchy sore or the bullseye. What if somebody sees one of those? Yeah,
well, so if you've had a tick bite and you know that it's been on there for a while, the earliest stage of Lyme disease is something called erythema chronica migrans. And it's a red spreading rash that starts right where the tick bite was, and then it just gets bigger and bigger and bigger, and sometimes it starts to look more like a bullseye than just a big circle, expanding circle. You must see your doctor if you start to develop that kind of a rash after a tick bite.
Okay, so what are some of the issues that can arise if you do have Lyme disease?
So Lyme disease has a whole bunch of different potential problems associated with it. Early on, you get the rash, okay, not a big deal, but if it's not treated, Lyme disease can actually affect your heart, it can affect your brain, and then later on, months and years down the line, untreated Lyme disease can cause a form of arthritis. And so there are blood tests that we can do when people have those symptoms that help us confirm the diagnosis of Lyme disease.
Okay, one more question from social. Let's see. Maria. Oh, does she need to take her vitamin D supplement if she's in the sun all day?
Well, this is going to open up a really big can of worms. So there's actually much more controversy about vitamin D than you would think. We're still living in an age where people think they're supposed to get their vitamin D levels checked and they're supposed to take supplementary vitamin D. And unfortunately, there are still a lot of doctors who believe that. In actuality, 99% of the population has a vitamin D levels that is totally appropriate.
Okay.
Okay. The number that most people think is normal is 30, but actually 12.
Wow.
12 is actually enough. And the overwhelming majority of people don't have to take vitamin D. If you lay outside naked, and I'm not telling you to do this, if you were to lay outside naked for 15 minutes in the middle of the day, you generate about 20,000 units of vitamin D. So if you walk around outside, you probably don't need to take a vitamin D supplement.
Okay. All right. So I guess let's kind of go back to, do you have another question? Okay, I have another question. Another question from Shelley. How long after a tick bite does a rash develop?
So usually that erythema chronica migrans will usually start to develop within a day or two after the tick bite. But remember, it's got to be on for at least 36 hours before you're going to develop even the possibility of Lyme disease.
Well, what if you see a rash like that, but you don't see a tick?
That would be a really interesting phenomenon.
Okay.
All right, because it always develops right where the tick bite was, and it's
Okay.
hard to imagine you would have had a tick on you for 2 or 3 days and not noticed, because once it gets engorged, I mean, it's like a nice sized thing sitting
Right.
on your skin. Someone would notice it.
Right. Okay. So I guess let's talk about some of the other heat-related injuries that happen around this time of year.
So other than the dehydration, so even if you don't get to the point where you have heat exhaustion, all right, sometimes people will get a little dry and they may get cramps, all right? So that's a common thing that happens in the summertime. Sometimes people get swollen a little bit in the summertime, and actually that happens a lot. We see that in our practice a lot, because people come in the summer saying, I don't know what's happening, all of a sudden I'm getting all this swelling around my ankles. Well, what's happening is your body is attempting to get rid of the heat, and the way it does that is by bringing more blood flow to the surface of your skin. Now, it does that by opening up the blood vessels. Well, when it opens up the blood vessels and more blood flows to your skin, some of that sort of leaks out. Right? The fluid sort of leaks out of the vessels. And that's why in Baltimore, this did not happen when I lived in Buffalo, New York, but in the summertime, everybody in Baltimore, their ankles get a little bit swollen, and it's just because of the heat.
Wow, that's good to know. See, and so we keep heaters under our desk, and then some of us here are talking about how our ankles are swelling.
Isn't that funny?
Wow, okay, so what about salt? Does your salt intake have anything to do with swelling, especially in the summer?
No, not usually. It doesn't.
Okay, so can we go back to, I guess, the dehydration, and what are some of the signs? So you're not quite heat exhausted, and definitely not at the point of heat stroke, but are there some symptoms that your body is saying, drink water, drink something?
Dry.
Okay.
I mean, you just feel dry. You would feel parched.
Okay.
And you would think, I need to drink something. It's getting a little bit gross here, but if you haven't peed in a while, okay? I mean, if you haven't passed urine and you've noticed, well, I'm feeling thirsty, and I know I haven't gone to the bathroom since this morning, that might be an indication that you haven't taken enough fluid that day. Let's talk about the issue of fluid, right? Because people think you need to take in 8 glasses of water a day. It's one of the common things that I have to deal with patients. Okay, where does that come from? What animal on the planet thinks, I need to take in X amount of water every day? All right, so that 8 ounces of water, 8 glasses of water is 2,000 milliliters or 2 liters of fluid. And yes, we're supposed to take in about that amount every day, but what they don't realize is that about 90% of the food that we eat is actually water. If you were to crush the foods that you ate, unless it was really dry, but a piece of fruit, a vegetable, it's like 90% water. So we're only supposed to drink really when we're thirsty. And if you do that, like every other animal on the planet, you'll do just fine.
Okay, where can we go for more information?
Well, you can always go to www.gbmc.org. We have lots of information on our website, and you can certainly speak to any of the family physicians that take care of you through our wonderful organization.
Dr. Ferentz, thank you so much for being here with us and giving us all of that information. And thank you guys for tuning in and submitting all of your questions. We'll see you.